Since the age of 18, I have been a full-time carer for my great uncle who has Alzheimer's disease. My heritage is St. Lucian and my grandparents came to the UK in 1956. After years of caring for a St. Lucian man, it was important for me to understand how culture and race can affect patients from Afro-Caribbean backgrounds living in the UK. Alzheimer's Research UK states, Alzheimer's disease is the most common cause of dementia, affecting around 5 in every 10 people. Over 800,000 people in the UK are affected by the disease. Majority of people who develop Alzheimer's are over 65 years old. However, 5% of people are under 65. Symptoms include memory loss, lack of communication skills, and in thousands of cases, some people are not able to carry out daily activities such as eating, washing, and shopping. In this documentary, we're looking at how racial disparities can contribute to patients from Afro-Caribbean backgrounds living in the UK. A timely diagnosis is an important tool that can prevent patients from severe symptoms. Patients gain access to relevant information, support, and resources. More than 25,000 people from Black and ethnic minority groups live with dementia. This number is expected to double by 2026. New research from the University College of London highlighted the difference in diagnosis rates between Black ethnic groups compared to white groups in the UK. In 2018, Dr. Doug Brown, research officer for the charity organisation Alzheimer's Society, stated that everyone has the right to know what condition they have, the right to care and support they need. It is vital that everyone has equal access to a diagnosis, regardless of their race, gender, age, or postcode. And we will continue to build our work with the government to make sure this happens. There is no official scientific reason that explains why Black people are not receiving a timely diagnosis. Without a timely diagnosis, the patient's symptoms may get severe. Family members are limited to resources available, such as social services, caregivers, and dementia charities. Attitudes towards Alzheimer's within the Afro-Caribbean community could be one reason why patients are not receiving a timely diagnosis.
I'm from Jamaica, and I know in Jamaica, people with dementia is deemed to have done something bad in the past, or it's a curse, or they're confessing. And this stigma is attached to dementia. Obviously, we brought our customs here, and we still think about it as a curse. And the reason that what happened then, we were hiding behind closed doors. We were not seeking the help that is out there. And my mother had Alzheimer's. And I started nursing when I was 18. And I rose up in the ranks of the nursing profession. And I didn't know anything about dementia. And I was afraid because of that stigma. And you know, when she died, I was angry. I was angry with myself, I was angry with everybody. And thus, I used to go to bed at night and thinking, you know, what is all this? And then something came to me, what are you going to do about it? And I got some of my friends, nursing friends together, and realized that they were in the same position as I was.
The disease is stigmatized due to the lack of understanding and awareness of Alzheimer's. Alzheimer's and dementia specialist Regina Polsva gives us an insight about how Alzheimer's is stigmatized in the Caribbean. Can you just tell me a bit about your experience with Alzheimer's?
Okay, so I've worked with Alzheimer's and dementias, different types of dementias for, 20 years, about 20 years now.
Mm-hmm.
Now, probably 18 of it was in the U.S. in assisted living facilities and home health and things like that. And then about 7 years out here in St. Lucia.
Can you give me a little bit of information about what kind of stigmas you've experienced working with Alzheimer's?
Well, when I first came out here, a lot of them didn't really think that Black people get Alzheimer's, especially here in the Caribbean. In the U.S., there's different reasons why the stigmatization is harder. Well, it depends on what area you're from as well. So they don't have access to proper care. And when they're in the hospital or doctor's office, I should say, it's just kind of passed off as just, well, you're getting old. So they pretty much think it's normal aging. And so they just brush it off and they don't really talk too much about it. And so the stigmatization really is that they overlook it as being an issue. It's more mental illness. And so the mental illness treatment is a bit harsh. Booked with medication, it's booked with sedating the person and kind of putting them in secured places and not having a dignified life more. They're treating it more like mental health, which I think mental health, by the way, is being mistreated as well, and they need to work on that too. But specifically with Alzheimer's and dementia, because the diagnosis aren't clear, they just automatically put Black people or people of color in that category, that it's more mental illness than a disease of Alzheimer's or a type of dementia. It's overlooked. My experience here in the Caribbean is the people out here, a lot of them have believed it was some kind of spell, so they just didn't have any awareness. There was no education about it, and so they're not familiar with it. And so doctors out here aren't familiar with it either, so it just gets overlooked as well. It just kind of puts them, now that they are a little bit more familiar with it, they still don't know how to treat it. Still use medication as the main source, as the main treatment. And everybody has Alzheimer's or everybody has dementia. They don't have a differentiating diagnosis. They don't take the training out here, and they don't update it. That's been my experience as far as getting proper diagnosis. People be fearful of it because they either think it's a voodoo spell so they just kind of ignore it.
How important is culture for Black Alzheimer's patients?
It's extremely important. I mean, to be honest, the Black culture are more social people, but once they reach a certain age, they are taught or conditioned to some extent to not do anything, to stay home and to just kind of just vegetate. And that's the worst thing you can do to a culture, is to keep them at home. They need to be social. And so with everybody being so busy, children being busy with work and everything, no one has time for the older person. So the treatment on the older person is not so good. But the Black community really took care of their moms especially. The culture is growing into separating the families, and, the families want to be successful and do things. It's such a struggle, the Black community, to get ahead because of how the white community makes it more difficult. They just don't have the same freedom and the same rights, to be honest, to make a better living and for their family. And so getting that help also has been a struggle. So we might be able to qualify for grants and all of that, but it doesn't send the right signal to the community. It sends the signal like, you're always helping me, you're always doing this. It never gives a sense of, well, I deserve it and I can earn it too. Down on the full of color of anything. It's always a push down, but you can't earn it. So it's kind of like, I'll give you a grant, but I can't give you a loan. That doesn't make sense. So you're mentally keeping the community down. When you have compromised illness such as brain changes, it makes it even more harder. And so you can't get the support that you would normally, that the white community would get with it, because it costs. It's a high cost in America. Probably, I don't know about the UK so much, but at the same time, once a Black person is in a facility or like that, it's a little bit different. It's more suppressing, oppressing, and things like that.
In the UK, Black people are more likely to get Alzheimer's, but we are less likely to receive a diagnosis. What measures do you think the UK can take to raise awareness and break down barriers for the Black community?
Well, they need to do better at diagnosing, because not everybody has Alzheimer's. I mean, they really need to rule out all of the conditions that can cause any type of dementia. And that's kind of like the prejudice. They don't know what to call it. And so since they don't understand details of dementia, everybody that I know that has Alzheimer's and dementia in the Black community is because really the doctors aren't really diagnosing them. They're just going off of their symptoms. And since it's been going and getting worse over time, That's the only testing that they have, kind of like a clinical test kind of thing, and they just rule off of that. And really, they haven't gone deeper. They really need to go deeper. They need to have not just mental health, a psychiatrist, but get a neurologist involved in testing them. They need to test everything, and they need to do imaging. They need to take pictures of the brain. It's so simple, and it's so easy for mental health to just say, oh, yeah, your age, yeah, you have Alzheimer's, instead of really ruling out what could be causing it. Because what I've learned about Alzheimer's and dementia and different types of dementia is when you have symptoms, you need to encourage those families, the persons who are experiencing them, to recognize it and not be afraid to go to the doctor and get it checked out, because it may not be Alzheimer's. It could be vitamin deficiency, hormone deficiency, and in the elderly, it could be an infection. And I've heard so many cases where people have told me that their mom or their dad, brother, started changing, and they started having all of these thinking problems and even hallucinating, some delirium. And they take them to the hospital, and then immediately they put them on dementia medication and behavioral medication. And the problem was they had an infection, they had a bladder infection, or they were dehydrated. And so now they're just, and those medications for the person works. It doesn't even help them because it's the wrong diagnosis. So you take care of the bladder infection, you take care of the dehydration, and the person goes back to being normal. I was just saying, over time, if these physical issues aren't treated properly and taken care of, it can fester and can develop into a type of dementia. It can send faulty message, start messing with your brain cells because you haven't taken care of the main issue.
One stigma in the African and Caribbean community is that dementia is a result of witchcraft or a curse. Some countries do not have the proper facilities to educate their community about Alzheimer's disease, and there is inadequate data about the condition. This could explain why witchcraft is used to explain the disease in African and Caribbean communities. Every culture is different, and not all people believe in witchcraft, but it is important to understand that there are stigmas and labels associated with Alzheimer's disease. For more information, check the program website at www.alzheimersanus.co.uk. In some parts of Africa and the West Indies, patients are labelled as witches, and older women who have dementia could be stoned, burned, beaten, and even killed. In townships and rural areas of South Africa, dementia is connected to witchcraft rather than to disease. Stigmas create a barrier between patients and society, and the consequences of stigma are incredibly important to understand. Social stigma can make it harder for patients to live with the condition. Society, and in some cases, even family members, can contribute to excluding patients from the community. This can prevent patients from seeking medical treatment, developing a support system, participating in clinical trials, and living the best quality of life possible while they are able to do so. There are many ways to raise awareness about the disease. The Department of Health and Social Care have been providing support for ethnic minority patients. They continue to place dementia advisors in Tower Hamlets community to increase diagnosis rates for BAME groups. Tower Hamlets provides a memory service and dementia care team that provide appropriate post-diagnosis support. Nick Parsons, dementia advisor working in Tower Hamlets, says
the cafes help the Somali Bengali community by getting a group of people together who can talk about different issues. They can talk with our workers who can give them more information. And a lot of people enjoy being in a group environment where they can chat to others in perhaps a similar situation to themselves. I think the most rewarding thing is offering support, in a sense, giving them hope, giving them knowing that it's ongoing support, not just one-off.
Other ways to overcome Alzheimer's stigma in the UK is to make sure that you seek support. There are early stage groups such as Alzheimer's Society that can help you. Sharing information is crucial to dispelling the misconceptions about the disease. Lastly, patients should be advocates for more Alzheimer's support and research. There are services available, but from my research, services are mainly for Asian dementia patients. Black men are more likely to get the disease, yet there are no dedicated services available for them to use. Even research is limited. Understandably, organisations like Alzheimer's Society and Alzheimer's Research UK are actively working towards raising awareness via their websites. Predominantly black areas such as Brent, Lewisham and Croydon should inform their communities. Organisations should work alongside these areas to raise awareness. There are plenty of other helpful resources that can help patients in general, yet there are no organisations to provide information for the most at-risk race. If this type of organisation existed, it could support patients with addressing stigmas of Alzheimer's. TED Talks and seminars are available. However, patients and family members might not have access or knowledge about where to find this information. Engaging with Black patients can close barriers. Promoting diversity and inclusiveness in dementia services can equip people and help close barriers. Gathering views of the community members can help to identify changes that can be put into place for future dementia care. Establishing the levels of staff knowledge and understanding the needs of Black patients should be a priority. Methods can be used to gather more research about the community. These include interviews with representatives from Afro-Caribbean backgrounds, focus groups, and policy changes. These are easier said than done. Unfortunately, there are challenges with providing inclusive services. Funding is the main challenge. Research shows action needs to be taken, but funding and resource constraints prevent them from happening. Here are my recommendations on how to increase awareness. Publicity about the availability of services through media such as community radio, posters, and adverts. There is a need for staff training regarding how best to approach patients in diverse communities. Employing health and social care workers from diverse backgrounds would also promote approachability of services. Health and social care organisations need to be present in community spaces to successfully engage with London's community. There needs to be representation of Black members on boards and committees relating to dementia.
The World Health Organization has said dementia is a public health priority now. It has become so huge in such a way that the World Health Organization is as recent as 2017, they've come up with a global action for dementia, where now every government in the world is being held accountable and responsible in terms of raising awareness, in terms of research, allocating resources to dementia care, supporting people living with dementia and their carers.
This part of the documentary will dive into the importance of cultural competency in Alzheimer's disease caregiving. Cultural sensitivity has been vigorously researched in healthcare settings. There is limited research about the importance of culture in relation to dementia. The Black population represents one of the largest ethnic minority groups in the UK, with over 1 million people from Afro-Caribbean backgrounds. Awareness of possible ethnic, racial and cultural variations in the caregiving experience, policymakers and healthcare professionals can meet the needs of Black patients. Research from Care Quality Commission highlights that 84% of people from Afro-Caribbean backgrounds wanted to raise concerns about the standard of their healthcare in the UK. Ethnic minority populations are less likely to access specialist or social care services.
Dementia is one example where we can see that there may well be some implications in terms of racial equality. This helps those people who are concerned with addressing dementia to do so better, as well as providing those people who are suffering from the effects of dementia in minority ethnic communities a space in which to share and amplify their voices.
Understanding the cultural heritage of patients living with Alzheimer's enables safe, person-centered care that focuses on the individual needs rather than the disease. Caregivers can understand what challenges there may be rooted in a patient's culture. The Social Care Institute Excellence is a values-driven, important agency in the UK that contributes to the development and implementation of better care, support and safeguarding at a national level. Finding patients opens the door for health and care professionals to start talking about cultural sensitivities. This section explores the resources that are provided by the government for Alzheimer's patients in the UK. The NHS and local councils can help to support patients and their families. The Adult Social Services Department can help with patients' personal care by providing carers, Meals on Wheels, access to day centres. In some parts of the country, the NHS provides Admiral nurses in partnership with the charity Dementia UK. Admiral nurses are NHS specialist dementia nurses who will visit you and give you practical guidance on accessing services as well as offering emotional support. The helpline number is 0800 888 6678 and is free to call. These services have helped thousands of families. However, just because these services are available doesn't mean it can guarantee Alzheimer patients a better quality of life. According to a recent Alzheimer's investigation, the NHS is treating many of the 280,000 people with dementia who live in care homes like second-class citizens. Poor access to NHS services is damaging the well-being and health of patients. Some horrid examples are being prescribed the wrong medication as a result of a GP's lack of professionalism, spending months in hospital due to the lack of mental health services available, waiting over 5 weeks for mental health referral, and waiting over 3 months for continence products. Continence products are essential items that patients need and are provided inconsistently. This can produce more health problems for dementia patients. There are over 600,000 carers of people with dementia in the UK. Caring for a family member living with dementia can be extremely challenging, rewarding, and can impact physical and psychological health. 48% of caregivers have had long-standing illnesses or disabilities. Women contribute 71% of the global hours of informal care. Carers of people with dementia contribute 11.6 billion of unpaid care. Caregivers are prone to stress. This can lead to mental health issues such as anxiety and depression. Other emotions are anger, depending on the behaviour of the patient, and some people have social withdrawal from friends and activities. Tips to manage stress. Know what resources are available. All organisations are posted on the Alzheimer's and Us website. Relax. Meditation can help relieve stressful thoughts. Try and find time for yourself. Respite care is available. Not every patient gets the opportunity to remain at home. 280,000 people with dementia live in care homes in the UK. Some people have to move into care homes as their dementia progresses. On top of this, many people with dementia have high levels of healthcare needs. 198,000 people with dementia are living in care homes. 41% of people with dementia have high blood pressure. 27% of people with dementia have heart disease. 18% of people with dementia have had a stroke or a mini stroke. And 13% of people with dementia have diabetes. Care homes are also under financial pressure as a result of a near 1/3 reduction in government spend on adult social services since 2010, alongside increases in demand and costs. Some GP practices are wrongly charging care homes and the people with dementia who pay for care home fees for services that should be free on the NHS. GPs should not charge for primary care unless they are providing a non-standard service such as hospital-style ward round. Researchers from UCL asked over 1,000 carers at 92 homes across the country to say if they had witnessed or taken part in troubling behaviour. Neglect and abuse in care homes has been a disturbing truth that was brought to light in the 2018 Pandora programme that broadcasted footage of staff appearing to mistreat patients. 10 staff members were arrested a week after the programme aired. There are 3 main types of abuse that can occur in care homes. Signs of physical abuse include the following: scars, bruises, and welts on the body, failing to take medication properly, the refusal of the caregiver to let you be alone with the elderly person. Caregiver neglect can manifest itself in the following ways: not bathing the person or leaving them dirty, the presence of bed sores from not turning the patient regularly, having an unusual loss of weight or dehydration, being unsuitably dressed for the weather, unsafe living conditions such as lack of heat, electricity, fire hazards, or lack of running water, leaving the elderly person alone at a public location. Financial exploitation is another way that caregivers may abuse Alzheimer's patients. Signs of these include changes in the person's financial situation, unexpected cash withdrawals from the elderly person's bank account, changes in power of attorney, life insurance policies, property titles or wills, lack of medical care in spite of having money for it, unusual goods, services or subscriptions the elder couldn't have signed for. If an elderly person is being abused, there is a confidential action on elder abuse helpline on 0808 808 8141. Some forms of abuse are crimes, so the police are always going to be available. Lastly, contacting the Adult Safeguarding Coordinator can prevent abuse in the care homes. Joining me now is caregiver Jennifer Taylor, who's experienced services in the UK and in her home country, St. Lucia. So can you tell me your experience with adult social services?
They do have services available. I find it very limited on the service that they offer individual OAPs or health patients. So it varies. They offer the very minimum and basic. It's always just, I'm just coming to check, make sure you're all right. But it's more, I find it more facts and figures rather than compassion and caring. So my experience with adult social services has spanned from 2 different boroughs. I was caring for my uncle, and I find both boroughs were on the same level. But I must say that the second borough, it offered a bit more. The fact that they did want to help the elderly instead of trying to take off the elderly. So I find it very, very difficult. So it depends on the borough and the social services. It comes down to the same thing. It's more about facts and figures than compassion and care.
Do you think that social services focus on Alzheimer's in the Black community and what resources they can offer ethnic minority patients in the UK?
There's no specific homes for Afro-Caribbeans, and a lot of boroughs fabricate stories of having such facilities. And when it comes down to the pushing and establishing that your relative or family member would be better off in such facilities, it is when you find out that your fund or the funding that was given to you or to your family member by the borough doesn't really facilitate for such individual need. I find that they don't really cater for their needs, but they use it as a falsified story to get Afro-Caribbean people to depart with their elderly people and making them believe that there is such facilities available. They are put in old people homes, which is not really a home for patients with Alzheimer's. So you find that the homes now does not know how to facilitate and care for that mentally ill patient with dementia or Alzheimer's. An elderly home only caters for people that is elderly, that is not able to help themselves. People with dementia can go to the toilet. They can be assisted do things. But if you are put in a home where it facilitates only for elderly people, you have not got the staff trained to help people with dementia. So in time to come, the toilet facilities and the training are lost by the dementia people because it's easier for the elderly or support workers to put a nappy on somebody that is able to go to the toilet because this is what they are facilitated for, not for any other aspects. And it comes down to funding and training and stuff. So, no, I don't find we have enough Afro-Caribbean facilities available.
As a minority ethnic caregiver caring for a Black patient, how has culture impacted your experience of caregiving?
Because of my Caribbean background, I'm able to get into their childhood, back into that concept of being at home. My conversation includes palm trees and beaches and fish, things that they grew up with and that is around them. Also, I'm able to offer, certain Caribbean flavors into their diets. bring them back to that childhood, that taste, have conversations about Caribbean stuff. I relate to the music. Also, the music is a big part of daily life because when they was growing up, they never had televisions. But you need to go back into their roots and bringing that happiness back out of them. That's what the Caribbean culture does. The fact that we are taught to respect and love our elderlies, that's also a big part of our culture. We don't look at old people as a nuisance. We have a saying, once a man, twice a child.
You've had caregiving experience in the UK and St. Lucia. Can you give me an insight on the differences between the two countries?
Oh, the big difference is isolation. In St. Lucia, it's more freedom. Health and safety is not so much of an issue. You find that they are more able to walk around and do things in their own time. They're not prison. They're not institutionalized. They're not medicated up to their eyeballs. That they're not non-existent. So the big difference is in the Caribbean, it's not even seen as an illness. It's seen as somebody that's literally is insane. However, they're not given drugs to make them act normal. They actually let them be who they want to be. As a caregiver, this is where we find that we are more able to offer our services that will be able to calm them down and actually be able to sit and deal with the mood swings and the changes that is arising. I find everyone in the UK is a specialist. Now, firstly, we have aligned activities. So you got your GP that's going to refer you to social services. It's then going to refer you to occupational therapy. That's then going to refer you to physiotherapy. So I just see it as a line of people that's actually making money off of somebody's illness. Yeah, it's like creating a difference of employment, just to make themselves look like they're doing something constructive. And nothing comes out of it except for that you just get bombarded with visitors. Actually, it does nothing. In Caribbean, you've got one or two people working with a party and actually get a fulfillment out of it because the person has literally looked different, they act different. We were able to work on them and get a medication that fits their need. In the UK, it's just, hey, I'll give him that. It must be, the Alzheimer's is getting well. Take this tablet, it will make him better. I would say I'd rather build a home in the Caribbean and take all the people from the UK back home and let them live in peace, at least, in the way that they should.
Whilst caregiving for your uncle in the UK and St. Lucia, did you recognise any differences in his behaviour when you were in the two countries?
Firstly, I took him out of a care home. He used to say this is not his home. He also wished that he was back home with his family. To me, he was showing signs of being isolated. I was one of the first people to be trained in the UK. I actually worked in one of the first care homes that was open for people with mental health and dementia. I recognized certain things that I actually pointed out, that my uncle has got the ability to talk and he did have the ability to do things, but he, being in the home at the time, he felt isolated. I needed to help him. So hence me taking the social services to court to repatriate him. I just felt that he needed to go back home for proper care because the UK was not offering care. I just found a lot of professional people were just arguing amongst themselves over a piece of paper that had a client's name on it. And that's what I found. I never really found them really interfering or helping the clients.
Can you tell me a bit about your experience with the NHS in the UK and how they dealt with your uncle?
Appalling. At the beginning, in the entry, it's all love and care. I must give them that. They tried their best. However, my uncle now, after breaking his hip, I knew he can communicate because he's obviously living with me. These are people that never knew him. They never came and asked me anything. They never saw him. They never gave him no training. They just went by a letter. Now, also, this is something else I found. They ask you for a medical history report. You give them a letter stating this is the medication, they literally put him back on everything that we've actually spent years trying to wean him off, so that he was in a better state of mind. I find that what's on paper is is what people relate to rather than what's in the eye. My uncle was thrown out of the hospital, well, literally thrown out twice. I had to get solicitor to intervene twice because as far as I can see, they was just sending him to a death. He already had pneumonia and they was transferring him into an old people's home. As a person that's supposed to be caring for people, I literally had to ask a question. Now, they spent in the region of 87,000 giving him the new bionic hip, only to tell me, oh, he's not going to walk again. What does that prove? That you use this man to habilitate and get funds for such operation, to be funded and get more funding, rather than look at him as a person. Now, that upset me as a caregiver for all the way. He spent 5 months locked up in a legal battle because they didn't like the fact that I recognized that what they were doing and I pointed out what they were doing. So they locked him up in this legal battle that he's not allowed to come to my home because my home is dangerous. After all these years, in fighting, I actually realized that what they was doing was an injustice. We got a solicitor to have them send him back to my home. Within 3 months of him returning back home, he was able to walk up and down the stairs because I got him a private carer to help him to stand up and balance himself. And we rehabilitated him into the man that he was. He was able to travel again after that. Now, people that have mental disabilities, I am sorry to say that, and I'm sorry to say to the system, that they are quickly to be palmed off, cannot fight for themselves. You as a relative need to understand that, and you need to put up that fight for them.
Health education programs and staff cultural sensitivity training needs to be a priority. Race and Alzheimer's and dementia are linked. The Black community need more support, and the government needs to help raise awareness in the Afro-Caribbean community. For more information, check our program website on www.alzheimersanus.co.uk.